protect ourselves. So let me first introduce the panel. Miss Padmini Chavan works with YRG Care Organization as a PrEP coordinator, and she has a very wide experience in working in the HIV space for many years, and she brings a very wide experience from the community angle to us as what is exactly happening on the ground. Dr. Jatin Choudhry is a study coordinator with Humsafar Trust. He's a dentist and public health specialist from AIMS Rishikesh, and he's been working with Humsafar for last 2 years. So he'll tell us about what is happening from the NGO perspective. And Dr. Siddharta, which many of us know already, is a medical officer with Safe Hands, and he has worked previously with Humsafar and has been very active in many of the events that we have been doing. So welcome everyone. Thank you for joining. So let me dive in straight to Jatin. Jatin, let's, now that we are talking about sex and STI, why don't you sort of tell us about STIs? What are these STIs, and how do we know that whether I have the STI or not?
Hi everyone. So I'm just going to keep it like very conversational rather than me, blabbering out what I have read or what I know. So like Doctor said, so STIs are sexually transmitted infections which are commonly transmitted through sexual contact. But so I'm going to keep it in English, Hindi, that works. English, Hindi both, or it's just English or Hindi? सबको समझ में आएगा English, Hindi. So STIs में, so as the name suggests, sexually transmitted infection जो कि sexual contact के through most commonly transmit होता है, but it also transmits through blood transfusion और parent to child transmission भी हो सकता है, जो कि PTCT भी बोलते हैं, right? So अब जैसे हम sexual transmitted infections की बात करें तो mostly most of them are curable, but some are not, some are lifelong. And ये आपका HIV के risk को और acquisition को और बढ़ा देता है, right? So STIs में भी there are different pathogens that cause STI, जैसे कि bacterial STIs होते हैं, viral STIs होते हैं, protozoal STIs होते हैं, fungal STIs होते हैं. So bacterial STIs की अगर हम लोग बात करते हैं, जैसे गोनोरिया आपने सुना होगा, क्लमिडिया सुना होगा कि अच्छा क्लमिडिया है, गोनोरिया है. Syphilis is a very common STI. So and also I want to make it clear, when I talk about STIs, I'm not talking about any particular gender or a sexual orientation. I'm talking as a penis, a vagina, and an anus. Okay, so I'm not referring to any women, men, trans, and I'm covering the whole LGBTQ spectrum here. So when I talk about syphilis, or there is bacterial vaginosis, and then viral may we have HIV, and we have herpes, genital warts, and then we have pubic lice and other STIs. So the one thing that is very important to know is that most of the STIs are asymptomatic, so you don't even know if you have an STI. Now, what are we going to do about it? So you can just and most can be asymptomatic, and most can show symptoms later. So that's called the incubation period, where you get the infection but you don't have the symptoms, right? And different STIs का अलग तरह का incubation period रहता है. So I think the 1 or 2, 3 common things that you can look at is like if you are having discharge from your private parts, it can either be penis, anus, vagina, right? And you have painful ulcers or lesions anywhere, or rashes anywhere. Extremities में rashes है, oral ulcers है, and so since we don't know and we cannot diagnose, and most of the STIs are asymptomatic, and क्या होता है कि कई बार symptoms जो है वो similar जैसे ही होते हैं. अभी if I have an ulcer in my mouth, I don't know if it is an STI or what. It also depends upon your sexual history. It also depends upon what kind of sexual activity you do, whether you've had a condom-less sex or not. So, or there are other reasons if you shed needles that I think Siddharta will be talking about. So, I would suggest is that if you have such kind of symptoms, agar ye sab symptoms hai, then definitely go to a physician and and get a proper diagnosis of that. So, yeah.
So you mentioned a lot of symptoms, and I was thinking about, अरे इसमें से तो आधा तो चीज़ मुझे होता है. And I'm sure the audience also feels that way. So how do we know? Ki suppose one morning I wake up and I'm peeing and I have burning while passing urine. Then is that an indication of HIV or not HIV, an STI? or if I get a rash on my body one day, then do I need to get worried about that?
I would say that it also depends upon your sexual exposure. It also depends upon, so for example, if you've had a recent condomless sex with someone, right? So then, if you are facing it like if you have that issue, right? So definitely go see a physician, because you have been exposed to someone where you didn't know what other person had, because we don't know STIs can be asymptomatic. The other person must be a carrier. He didn't know that he has an STI, and you ended up having a condomless sex. And also I want to mention that when we talk about using condoms, right? So STIs, they सिर्फ anal, vaginal or penile sex से ही नहीं होता है. It also happens to oral sex. So when we talk about using condoms, let's just not keep it down below the waist. Let's use it up also.
So are you recommending that we use condom while practicing oral sex?
Yes, definitely. Definitely.
That's terrible. But that is the doctor's recommendations, and that is what we should do. So you mentioned about HIV, so I want to straight away jump into HIV, and I'm from the generation which has seen the HIV epidemic grow and the homophobia grow, and all those problems that we had, and it is scary. So when somebody like me or people who are older than me, when we look at HIV, we are very scared. While I see today's generation has a little different perspective to it. So I think we need to go into the nuances. So Siddharth, why don't you tell us something about HIV? How is it transmitted, and how do we detect it to start with?
So hello everyone. I'll also try to keep it mixed. Hindi में भी बात करूँगा, and I'll also try to speak in English. So HIV, as we all know, like previously it was called GRID, Gay Related Immunodeficiency Syndrome, क्योंकि पहले ये धारणा थी कि जो homosexual community है उनमें the prevalence is quite high. But now with advancement in research in medical science over the past decades, we know that it's equally prevalent in the heterosexual population as well. How does it spread? Through unprotected sexual contact, or through blood to blood, or from mother to child, or during birth, or through lactation as well, if the mother is a carrier. हिंदी में किसी को चाहिए ये translate करके, और this is fine. Fine. Okay. So that's how HIV gets transmitted, and that is the reason that we always keep on focusing on the point of protected sex, of having sex using condoms. Now, the highest transmission of HIV through any kind of penetrative sex is during anal intercourse. Mediocre possibility lies with vaginal intercourse, and lowest possibility lies with oral intercourse. Oral intercourse से HIV नहीं होता है ऐसा नहीं है, संभावना है, लेकिन संभावना है 0.001%. 1000 में एक इंसान को 1 in 1000 person may get HIV because of having unprotected oral sex under special conditions where there may be an ulcer or a wound or cut or a lesion in the mouth or in the gums or tongue. So that's why we need to use condoms, because we as a community, since we practice anal intercourse, so and the transmission rate is highest through anal intercourse, so we are at increased risk. And so we need to be careful about our sexual practices and health, and that's why we need to engage in protected sex. Through oral sex also it may spread, and hence we have an entire industry of condoms, the flavored condoms, to promote safe oral sex. Through mother to child it may spread. So for those reasons we have certain medications which are called as ART medications, to prevent transmission, to subdue the viral load of HIV virus in a positive person. We have also medicines like PrEP and PEP. Prasad, should I go into it?
Yeah, let's first hang on to how is HIV transmitted. Now, Siddharth, Jatin, you have been working in Humsafar in the in the community setting. What sort of experience do you see in Humsafar and around from the point of view of safe sex practice and transmission of HIV? Do you have anything to add?
I would say that we, as in community-based organization, have been running programs where we have been talking about prevention, we've been talking about ART, where we've been talking about PrEP and PEP, and also providing them. So and there are also a lot of information, education, communication, IEC material that is available at our website and through our various outreach teams. So on field also and virtually also, we do have certain research projects that are going on that deal with virtual interventions, that how we can or on virtual platforms jahan pe we provide knowledge knowledge related to prevention, related to treatment. So yeah, so right now we are on our way to reach the goals of 1995. And yeah, can you tell us what that is? So if you would know that NECO had said that by 2030 we need to have 95, 95, 95, which is like 95% of the people have tested for HIV, 95% people who test for HIV, they know their HIV status, and 95% of people who know their status are on treatment. So this is what 95, 95, 95 is. So that is what that is where the whole money of NACO is going right now. But yeah, to achieve that,
including last 95, the goal is that all 95% people are virally suppressed.
oh, yes.
Yeah.
So Padmini ji, from the community perspective again, we are talking about HIV transmission. In your practice, in your organization, what is the pattern that you are seeing from the point of view of transmission? कि कैसे ये transmission हो रहा है at the ground level? Because here we seem to be slightly more focused on gay men perspective, but there's a very wide, community out there. So what is your experience?
Yeah, from my that work, community means FSW, MSM, TGs, TG and LGBTQ, including all the peoples. But when the things comes out ना कि मेरा partner है, मेरा प्यार वाला है, वहाँ पे सब sacrifices हो जाते हैं कि less condom use, less other things are very, मतलब वो सारी चीज़ें बंद हो जाती है जो हम लोग बोलते हैं कि each and every sexual encounter we have to use condoms and all that things. बट जब पार्टनर या प्यार वाला का जब बात आती है, जब FSW, TG, MSM एंड ऑल द LGBTQ में, तो हम लोगों का मतलब ये हमारा एक ऑब्जर्वेशन है कि ये जब ट्रस्ट वाली बात आते हैं तो ट्रस्ट विद कस्टमर है, ये है, उनके साथ में कॉन्डम यूज है कंसिस्टेंटली. जब हमारा खुद का ट्रस्ट का बात आता है कम्युनिटी का, तब वो बोलते हैं नहीं, ये तो मेरा पार्टनर है, मुझे उसके ऊपर ट्रस्ट है, तो आई नो नीड टू यूज कॉन्डम्स एंड ऑल दैट थिंग्स, प्रिवेंशन सब. तो ये जो बातें हैं यहाँ पे उनको बहुत बड़ी ये होती है, मतलब हानि हो जाती है कि बट एक्चुअली दैट पर्सन इज दैट मच ऑफ लायबल. तो कम्युनिटी जो है, कम्युनिटी ये सोचती है कि नहीं भाई मेरा बंदा है, मैं पहचानती हूँ और सब कुछ मैं ट्रस्ट करती हूँ, तो मुझे उसके ऊपर नहीं, मुझे कॉन्डम यूज़ नहीं करना है. तो ये सारी जब चीज़ें आती हैं ना, तो हम लोग कम्युनिटी को बहुत बार बता भी दिए होते हैं, बट कम्युनिटी का एक थिंकिंग होता है नहीं भाई मेरा बंदा है तो वो मेरा मानना है, मुझे उसका सुनना ही सुनना है. तो ये वाला एक थोड़ा सा रिस्की मत के मिल जाता है.
I guess that also comes from the way our community is, that we're so much looking for love that when you find it, you are willing to give everything, right? You're willing to sacrifice your life for that. The other interesting thing which I often see on Grindr, and when somebody says, I'm open for unprotected sex, I actually go and chat with those people and I ask them why. And most of the time these are young people and I'm very curious what's happening here. And I have got responses such that I only do it with people who look safe.
So, Prasad sir, I'd like to add here something. So, when I was working with Humsafar, this was my experience when I would elicit the sexual history of patients and I would ask them, why do you engage in unprotected sexual intercourse? A very commonly encountered reply would be to get that extra pleasure, the skin-to-skin contact, the surface-to-surface contact. Then I just would ask them to do a profit and loss analysis, like would you want to go for a lifetime therapy on ERT medications to keep your HIV under control, or you want to go for skin-to-skin contact during penetrative intercourse? So But still, I mean, when you're raging on your hormones or when you're emotional, you crave for love and touch, you tend to overlook things and let go things.
Absolutely. So let's come back to the point of PrEP, because that's a whole discussion now that we are as a community engaging into unsafe sexual practices. We now also has many couples who are serodiscordant. So one partner is positive, one partner is negative. So what can we do and how can we use PrEP to protect those people? Why don't you tell us a little bit more?
Could I use the whiteboard for that?
Sure.
So there's something called as PrEP. There's something called as PEP, and there's something called as ART. Okay, please excuse my handwriting because I'm a doctor. So PrEP, PEP, and ART.
Can everyone see the board clearly?
And people sitting on these
Or
sides.
we can move the board in the light.
So under these three categories, the medicines which are used, the drugs or the compounds which are used, these are more or less the same. Okay. So if the drugs are the same, then why do we have categorizations amongst these medicines? The compartmentalization depends on two factors. It depends upon the status of the person and the time with respect to which the exposure had occurred. Now, status of the person can be positive or negative. If the person is positive, the person will go for ART. If the person is negative, the person will go for PrEP or PEP. Now, whether PrEP or PEP, that will depend with respect to the time. If the person has approached the doctor after the exposure has occurred within 72 hours of the exposure, then he'll go for PEP. But if he has approached the doctor before a planned exposure to be on preventive therapy, before exposure, then he'll go on PrEP. So along with condoms, nowadays we also have an additional or an adjunct method of preventing HIV, that is PrEP. So PrEP is pre-exposure prophylaxis. Prophylaxis means prevention. PrEP medicines are same as ART medicines, but you have to take these before your time of planned exposure. One thing I would like to mention, that whatever data is available in medical literature is with respect to PrEP is available only in reference of receptive partners. In case of the heterosexual population, the receptive partners would be women, and in case of queer population, the receptive partners would be the passive partners, alright, the bottoms. So PrEP data is, the majority data is available with respect to the receptive partners. So that's how PrEP is used before the exposure. How do you take it? You take it on a daily basis, or you can take it on demand. Daily basis is preferred. It should be taken at least 7 days prior to your planned exposure in case of queer relations. And in case of a heterosexual woman, it can be taken 20 days. It has to be taken 20 days prior. And it has to be continued if the person is sexually active. Prasad sir, this was about PrEP.
Can I add something?
Yeah.
We can also, I don't know if it's in the US, but event-driven PrEP, which is 211, we don't give it, right?
No. So that's what
India, we do.
that's what I told Jatin. On-demand PrEP. But on-demand PrEP, I personally don't endorse. And I think Dr. Rohan from IRG Care also, he doesn't endorse of it.
In India, it might be
I know people who are on-demand PrEP, but I personally as a doctor don't endorse of it, because then it gets very irregular and that can lead to PrEP failure. So I don't endorse of it personally. I am more in favor of on-demand, daily basis, regular basis PrEP.
So when you say a daily basis PrEP, do you mean, so which people should take it? I mean, should all of us take it, or?
Okay. So in that case, a person who is contemplating of starting PrEP, he is first supposed to go to the concerned doctor. कहाँ पे वैसे डॉक्टर्स मिलेंगे? In Mumbai and suburbs, we have Humsafar Trust, we have Dr. Safe Hands, and we have IRG Care providing PrEP and PEP services. So if a person from the community who is willing to start PrEP, they can approach us, all right? And
But who should start?
yeah, that's what I'll come to it right now. the doctor will elicit the history. Certain points would be checked for, like there's those points which will indicate that the person has high risk sexual behavior. High risk sexual behavior, like the person has multiple partners, the person has history of engaging in condomless sex in the past, the person has history of engaging in sex under the influence of alcohol or drugs, because he is in a different zone at that time, he may not remember to wear a condom. So these factors would be checked. Then other factors like whether the person has history of engaging high fun or not, whether the person has a history of engaging in transactional sex as a customer or as a service provider or not, whether the person has a history of having difficulty in negotiating condom usage with their partners or not. So, so even serodiscordant couples where one partner is positive, the other person is negative. Padmini ji brought up that point. So these points are the ones which would be looked for in the history. So if these criteria would be satisfied, then the doctor can take a call to start the person on PrEP. This is based on the history. And then certain parameters would have to be checked on blood investigations. So Prasad, so basically this is these are the people who may want to go on PrEP or ideally should be on PrEP.
So as I understand कि जो लोग recently unsafe sex किया है, who have done unsafe sex recently or who are regularly engaging in unsafe sex should be on PrEP, or in people who have partners which are positive but they themselves are negative, right?
With respect to unsafe sex, I'll modify. अगर unsafe sex 72 hours के अंदर हुआ है, then the person has to be on PrEP. Otherwise,
but repeatedly, like
repeatedly, if there's a repeated pattern in the history, frequently unsafe sex हो रहा है, then he's at a high risk of contracting HIV and other STIs.
So the other way of looking at it, unless you are doing that, you don't need to be on PrEP.
See, I say
so the point I'm trying to make is, I see a lot of people going on PrEP while they are the ones who are actually being extremely careful with their life. These are people who are practicing safe sex, regularly, and they want to take it to an extra level by being more safe. And as I understand, that is not an indication for PrEP. But these are the people who are doing it because they are highly motivated about their health. There are also people who probably can afford it. So what is your take on those people using PrEP?
So I would say if the sexual frequency is very low, like sometimes I have had clients.
No, I'm asking you about people who are having whatever frequency of sex,
irrespective of the frequency,
but always safe sex.
So see, in that case, I would say if the person is engaging in safe sex, there can always be chances of condom rupture. So PrEP and condom in this case can act as a double barrier. If the first barrier, that is the condom, gets ruptured, it fails. In that case, PrEP, if it is present in the body in sufficient bioactive levels, it will prevent the inhibition of the HIV virus in case if it enters through the ruptured condom. So it's like a double barrier.
Actually, might be आपका जो question है वो ये है कि अगर वो low risk में है तो उसको क्या वो PrEP शुरू कर सकता है क्या? Exactly?
नहीं, शुरू करना चाहिए क्या? कर तो सब लोग
जब हम लोग को पता PrEP is the medication is वो विदाउट प्रिस्क्रिप्शन नहीं शुरू हो सकता है, और प्रिस्क्रिप्शन के लिए डॉक्टर के साथ कंसल्टेशन के बाद ही डॉक्टर प्रिस्क्राइब करता है. इन दैट प्रिस्क्रिप्शन इन दैट प्रोसीजर डॉक्टर टेक्स ऑल द हिस्ट्री एंड डॉक्टर डिसाइड कि वेदर यू आर स्टार्ट और नॉट. क्योंकि if you are more possessive for your health, then you have might be risk ना. So वो risk अगर अच्छी मतलब अगर genuine है तो ही डॉक्टर प्रिस्क्रिप्शन देता है, नहीं तो otherwise not prescribe.
Yeah, what she is saying is true, but I have seen cases in community where people have self-medicated and started themselves on PrEP. I do not support that. What she says in that case is applicable. The person should first contact a doctor. There is YG Care, Humsafar and Dr. Safans. They should first go there and meet the doctor. They should not self-medicate.
And while we are talking about our experience and our opinions, let's highlight that it is actually not our opinion that matters. These are the standard guidelines which are given from all sorts of international communities, including the WHO, who should start PrEP. Now the problem with PrEP, of all of us going on PrEP, is two. One, is that we will develop resistance to that PrEP faster than we would develop if we use it judiciously. That's number one. Secondly, the danger is if you are on PrEP, you are likely to be less careful because PrEP to chalu hai, and then you may actually then lead to some unsafe sex in some people. So use of PrEP, I think a judicious use of PrEP is very important, and we should not have, because then we see people who start PrEP and then they just stop it and they start and stop, and then that is exactly what led to the pandemic of antibiotic resistance that we see in medical practice now. Everybody has cough and cold. Tum Ciplox le lo, tum Augmentin le lo, and people go and self-medicate. PrEP will become that. If we don't,
that's one of the reasons, Prasad sir, since you said stop, start and stop, start and stop. That's one of the reasons that I don't endorse a on-demand PrEP.
Jatin, what's your take on this?
Yeah, that's what I was gonna say, that you won't get PrEP just like that, right? You need a prescription, and the doctor will take your sexual history. So yeah, doctor will take your sexual history, and then only after and also some tests that need to be done, because and like you said, see, I think if a person is there is a frequent condom rupture, then I think maybe the way you're wearing the condom is not right, because people don't know how to wear a condom, and that is one of the issues. Condoms slip off and they tear, right? So first correct that, learn how to wear a condom, and if that kind of event happens, then go for PEP, right? Because then for 28 days you have to take that within 72 hours, and sometimes if you get late, then 72 hours still take it, because it's still an extra. But ye bhi nahi ki like abhi 15-20 din ho gaya and then you are like coming. So that is something that is there. But yes, then definitely if you are still within that, and 1-2 घंटा अगर ज़्यादा होता है, then start with them. So yeah, I think people with high risky sexual behavior, maybe people with injecting drug use, and specifically for, I think for MTCT, which is mother to child transmission, also PrEP can help. So if you are pregnant and
mother to child, the mother is positive, she will be on ART.
Yeah, but if there is father is negative. No, but it also for example, if a mother is negative and the father is positive.
In the discordant couple, serial discordant couple, that might be a risk for mother, that wife, that partner for HIV positive. But with PrEP, with the help of PrEP, that person is also negative, and the baby is also conceiving. That mother is also conceiving. So recently we have 2 examples in Thane district from Bhiwandi, that 2 discordant couple, the females are negative, and last month both are conceiving with the help of PrEP, and both are negative.
Yeah.
Wonderful.
That is a very good achievement for us also, because PrEP is quite not 100%, but with the condom use, PrEP and condom, that is 97% of assurance.
Yeah. And I just want to highlight a few points, that PrEP and PrEP, they don't protect you for STIs, so you have to definitely use a condom. PrEP and PrEP don't have any other drug interactions as such, and it doesn't affect the pregnant women, so it's completely safe.
I have a different
opinion on that.
Is it? Okay.
I got pricked, I think a couple of years ago,
and
The patient was positive.
I had to take PEP. It was awful. It was awful. Horrible. I had
Terrible side effects.
Prasad said that depends upon the regimen of drugs which you were on. So, as per the latest regimen, which is, it's in short form, it's called TLD. Not everyone will have side effects like nausea, vomiting, and all. And even if you have, it will be only restricted till the first 1 week. It is self-limiting. These side effects will go off. So, PEP and PrEP, I do understand they come with their own baggage of side effects, but there's no drug or no medicine in this world which will give you 100% efficacy and 0% side effects. Even paracetamol has side effects, alright? So it's a different thing that the side effects may occur or may not occur in your body, alright? So I know of people who are on PrEP, but they do not have side effects. I also know people who have been on PrEP and in the initial 1 week they have had harrowing experiences like nausea, vomiting, giddiness, headache, fatigue, body ache. Alright, but by the end of 1 week these side effects start subduing down, they are self-limiting. Research data shows that side effects with respect to PrEP occur mostly in 65 plus age group. Under 65 plus age group, hardly there are any side effects documented unless the person has any previous history of kidney disorders.
So, with any drug that we are taking, we have to be careful, and the panelists have highlighted that if you're starting PrEP, you need to go to the doctor because the doctor is also going to elicit what other conditions that you have. You have diabetes, kidney problem, hypertension, heart issues. Also, which medications are you taking? Because many of the medications interact with each other, and then they may have, the medications themselves may become then less effective or more effective. So, on the counter OTC PrEP is not what we should do, and we must always go to the doctors to check do you really need PrEP or not. So coming back to you, Jatin, we've spoken about prevention of HIV to a certain extent, and Padmini ji rightfully pointed out that if we use a combination of condom and PrEP all the time condom, then we have a 97 to 95% chance of prevention. But how do we prevent STIs?
So I think condom use is anyways like the yes. Also with condom use, when you say flavored condoms are meant for oral sex. When you use the same flavored condoms to do vaginal sex, what happens is that the flavored condoms, they have sugar in it, and then that can also cause, I don't know if a lot of people know that. So the flavored condoms are meant for oral sex, and that's something that I also learned a few days back. I also learned something new today. Yes. So flavored condoms has sugar in it. So if you don't clean it properly after using the flavored condom, so that sugar, that it can get bacterial infection.
Can be a medium for bacteria.
Yes, exactly. So that is something that you should look out for. Also, I think most for example, if you are using condoms, if for doing anal sex, then obviously use a jelly as well. Don't hurt your partner or get hurt, because what happens is that the area, I'm not going to use the technical words, the area there, the lining there, epithelium is very soft and very sensitive, and if you will be harsh to it, then definitely it's gonna create injuries there. So that, and then you're gonna be more susceptible. Also, the second thing is that when you're having sex, and I would say that try avoiding any substance use and having sex like alcohol or HF or meth, anything, because what happens is that when you do that, you lose your ability to take the right decision at that point of time, and then you end up having sex without condoms. So that is something there. And then there are other methods also, like there's UID interception devices, condoms, dental dams are there. So all of that is there, and definitely condom is something that you should vouch for, and select your favorite flavor and do it.
I would like to add here something. Very often I have had people who have come to me for PrEP, and they have told me, if we are on PrEP, then we can take a decision of going for bareback, of engaging in unprotected sex. So it doesn't work like that. There are two reasons for it. PrEP will only give you 90% protection rate. So 10% there are chances of PrEP failure. So despite taking PrEP, you may turn out to be positive for HIV. So how do we reduce this 10% margin or increase the 90% prevention rate? That is through clubbing condoms with PrEP usage. When you club condoms with PrEP usage, as Padmini ji said, the prevention rate increases to 97%. As per some studies, it increases to even 99%. So it's almost 100% when you club condom usage with PrEP consumption. Alright, it acts as a double barrier. So the other reason is that PrEP is only going to prevent HIV. For this, I have had counter arguments like HIV is only the disease which is a lifelong one. Alright, other STIs are the ones which are not lifelong, they are curable. So we can take a calculated risk of engaging in unprotected sex. So to this I would say no. There are two other STIs other than HIV, like hepatitis B and hepatitis C. These also tend to be lifelong if you do not take treatment for it. All right. Uh, so just like HIV, hepatitis B and C also spread through unprotected sexual intercourse through blood contact, and they also tend to be lifelong. HIV, as in the end stage, it results in AIDS if you do not take treatment. Hep B and Hep C can lead to liver cancer, liver cirrhosis. Alright, if treatment is not taken. So obviously, you do not want these diseases in your system, in your body, right? So PrEP is only going to prevent HIV, not Hep B and Hep C. For Hep B and Hep C, ultimately you have to use a condom. This is the other reason why condoms are still a must, despite being on PrEP.
Just one point, just adding to what Siddharth said. The other thing is for cisgendered women, I would say there's another STI called genital wart or human papilloma virus, which can cause cervical cancer in women. So that's something.
In gay men also it can cause anal cancer.
Anal cancer, but the probability of it, okay, for the audience, yes. But then genital warts is something that it, human papilloma virus cause in gay and men. Also, the other thing, just one thing, partner notification is also something that you need that we need to understand, because what happens is that if you have been diagnosed with an STI or HIV, then make sure that with people within 60 days you have had any sexual encounter with, ask them to get themselves tested. Because sometimes what happens is then it becomes like a chain and we don't inform them, and then what happens is that they might also carry it and then spread it to other people. So yeah,
that's a responsible thing to do. I'm going to jump in as an oncologist and the HPV question. Yes, cervical cancer in cisgender women, we are seeing a huge rise in oropharyngeal cancers, tonsil cancers in gay men because of HPV infection. There is a vaccine available for HPV infection. That vaccine ideally should be taken from the age of 9 to 14. We're all past that phase. Then there are studies which say that you can take it up to 26, and there are some new studies coming in saying that you can take it up to 45. But the best time to take that HPV vaccine is before you have sexual encounter. We are all past that, I can see that. But if you have nephews, nieces, children, relatives, please encourage them to get the vaccine done. In India, it is done primarily for girl children, but world over many countries are now promoting it for boys as well, to prevent the other infections. Hepatitis B vaccine is a must. If you haven't taken it, please take it now, right now. GB has conducted many camps in the past, and GB, I think it's time we do another camp. But that is something that we must do.